So news broke a couple of days ago that Joe Biden had asked Dr. Fauci to stay on and be the chief medical advisor.
President-elect Joe Biden said in an interview yesterday.
This was Fauci's response on Today this morning.
To wear a mask for 100 days. He said just 100 days, not forever. Is that enough, or do you feel like that might put an artificial time limit on how long people may need to be wearing masks?
No, he didn't mean it that way. I spoke to him about that. What he wants, he just wants to get, and it's a good idea, uniform. He's saying, hey, folks, trust me, everybody for 100 days. Now, it might be that after that, we still are going to need it, but he just wants it, everybody for a commitment for 100 days. And I discussed that with him, and I told him I thought that was a good idea.
He also said when he spoke to you, he asked you to continue in your role, which you've had under 6 presidents, but also to serve as his chief medical advisor. Will you do that? Did you say yes?
Oh, absolutely. I said yes right on the spot. Yeah.
That's encouraging. What's not encouraging is this story I saw. Officials aren't sure exactly what's driving the COVID-19 surge. I wonder what could possibly be driving the surge. Lack of federal leadership? Providing money to people so that they're able to stay home if they can? Mask mandates? I wonder what could be driving the surge? Since COVID-19 cases began to rise in late October, they've been rising steadily for months before late October. Small gatherings were quickly pinpointed by state officials in Virginia and across the country as a significant contributor to the spread of the virus. And they're rising right now because people are gathering and they're not wearing masks. 3 days later, he reinforced the messages to Governor Northam. Instituted a midnight curfew for restaurants and a ban on gatherings of more than 25 people. I mean, there's a lot of contributing factors. The fact that the weather started getting colder. People started being indoors more. You had the expiration of unemployment benefits. People had to go back to work in the middle of October. Everything is just compounding this problem, and we don't have leadership. And unfortunately, the framework of our country, it has to be the Fed to take the reins on this, because there are a lot of things that are unconstitutional that you can't do at the state level. The new mandates were quickly criticized by some of the administration's political opponents, especially when it came to the limit on gathering sizes. And that's why I hate that it's an attack on your liberty. Like this delegate Todd Gilbert here, incredibly disappointed to see the governor announce drastic, new, and confusing. Now, I will agree with him on confusing COVID restrictions, because it's like you've got to do a balancing act. You've got to try to give the people the ability to go out and earn a living, because the federal government isn't providing people with the money. I feel sorry for restaurants, bars, live event venues that are going under. I honestly do. But I also feel sorry for the 3,000 plus people that died yesterday. Halloween was a factor. This has all been a disaster. And we're not anywhere near close to help. There is no light at the end of the tunnel right now. And then you have this nurse in Tennessee This is heartbreaking.
Access to information.
That's where News Channel 5 chief investigative reporter Phil Williams continues our coverage. Phil.
Well, guys,
What up, Phil?
we continue to track the numbers. Every day almost brings a new record for hospitalizations, but a lot of people just don't seem to be swayed by the numbers. That's why one Tennessee nurse wants you to see the crisis through her eyes.
Okay, so I guess where to start. We started this fight together. We started staying at home, not going out unnecessarily. As a community, I think that everybody did really well. They fought with us.
If you want to see real COVID fatigue, look into the eyes of Nurse Emily Egan.
And now, I guess they're tired of it, I guess.
And that's another thing that is going to make this problem even worse. The strain that we are putting on our healthcare workers. Nurses and doctors aren't going to keep putting their lives on the line. I'm amazed that we haven't seen a nationwide nurse shortage yet, but I'm sure it's coming. And it may very well be localized to different areas that they're begging for medical personnel. There was a story in, I think it was Montana, where they had to have nurses that were diagnosed with COVID but weren't showing symptoms to continue to work because they were short-staffed. And it's just going to get worse.
People are tired of being alone or in their homes and want to get out and be social again. And we understand the importance of mental health, but the fight is getting out of hand.
For the past month, Nurse Egan has worked the COVID ICU at Holston Valley Medical Center in Kingsport. As COVID hospitalizations continue to skyrocket across the state of Tennessee, she has seen the faces behind the numbers.
We're losing more than we're keeping. I put an ungodly amount of people in body bags that I wasn't prepared to do, that I wasn't prepared to give up on a patient, but there was nothing else we could do, and we lost them.
Across Tennessee, hospitals are feeling the strain. Sadly, some days the number of available ICU beds depends on the number of people dying.
There's been days that I have lost 2 patients, did their care and got them moved out to the funeral homes, and had to take 2 right back that were equally as sick. I go home, I carry it home, I cry a lot. I cry a lot.
Nurse Egan says she gets that some people don't like wearing masks, that breathing through them isn't always easy.
But seeing these people die that can't breathe, you know, like it starts to take a toll on you. And you feel so frustrated that they didn't take it serious, you know, like I can't tell you how many patients that we've had that they contracted it at a ball game or at a family affair of some sort, you know, some birthday parties or dinner.
And that's another thing, especially here in the South. I don't know how it is in other areas of the country. They've been all about playing some football, basketball. You look through the comment sections on Facebook, and that's what, oh, my kids don't get to play basketball, man. I'm stunned. The reckless disregard for human life. Yes, in Kingsport, Johnson City, in East Tennessee, they have ordered refrigerated morgue trucks all over Tennessee because Governor Bill Lee has been a gigantic piece of shit. We talked about the lack of federal leadership, but in states like Tennessee and then in Alabama, Governor Kay Ivey, Governor Meemaw they call her, who shouldn't even be governor, she was the lieutenant governor, under a governor that got the boot for having a sex scandal. Because, you know, of course, Republicans are involved in sex scandals. Brian Kemp over in Georgia. No leadership from these people. And we did the story, I think it was last night, where health officials are saying, like, hey, on the local level, you need to take these matters into your own hands and institute mask mandates. Even if you're not getting any support from the state. And think about it. Think about how many people died on 9/11 and how many billions of dollars we put towards the forever wars that we're stuck in now. And you can't even give people $1,200 to stay the fuck home. It is infuriating.
In her case, she hasn't seen her own grandparents in months because these days, she says, require all of us to be willing to make sacrifices.
I'm giving these patients my all. I've sat with them. I've held their hand as they died because family couldn't be here. And it starts to hurt. And if you could just stop one case by wearing a mask or staying home.
$6 trillion. You are correct.
It would help us so much. Just one case. If everybody did that for one person.
We can't pass a $2 trillion bill that actually helps people and gets this shit under control. But there's no money to be made on it. At least when you go to war, it's a jobs program for the defense contractors that fill your political coffers. It's disgusting.